Congressman, first, how are your constituents? It's my understanding, represent a district very near the one that houses New Rochelle, where one of the strictest quarantines is in place. How are you guys doing?
Well, that's right. I represent the area just north of there in the Hudson Valley of New York. Well, look, I did a telephone town hall last night. 33,000 of my constituents got on the phone, and we took questions for an hour. People are concerned, understandably. They see confusion and mixed messaging at the top. They know the response has been slow and inadequate. They are dumbfounded that in the United States of America, we have not done the kind of widespread testing that would allow us to understand the epidemiology of this disease so we know what we're talking about. They have done that in other countries, and so my constituents also want to know why we're not working with our international partners so we can understand the global experience with this virus so that we can learn the lessons in time to do us some good. There's a lot of good things being done at the state and local level. Yeah. I really want to commend the governor of New York, who I think has been very effective in his response. We have passed $8 billion out of the Congress, and that's great. But the real challenge now is whether the administration can get that money out the door. You've worked in the White House, so have I. There's a big difference between passing the bill on the Hill and getting the agencies out of gear and spending money where it's needed. We should have thousands of mobile testing centers in the United States where we could understand the spread and incidence of this disease so we know what we're up against.
Congressman, how effective can you be, though, without decision-making about just people's mobility coming from the top? And I guess I ask that question because even if you do everything right, if flights are coming in and out and people happen to live in your district coming into the country from Italy or other places and there aren't tests at entry back into your district, it would seem that those efforts would be futile.
Well, look, what we need to do is we need to do sufficient testing on a great enough scale so that we understand exactly what the epidemiology of this disease is. In other words, are there a bunch of people out there with very minor symptoms who have the disease? That could counterintuitively might make us feel a little better because it would mean that the mortality rate is actually lower than we think. It might be that if we understand that it's that widespread, maybe it's going to make sense in the future to isolate vulnerable people rather than people who have the virus but who are themselves not very sick. In other words, we need to understand the disease. And you're right, Nicole, there is, in a crisis, no substitute for presidential leadership. And it is outrageous and infuriating that the President of the United States has happy-talked this virus. He has buried his head in the sand. He has undermined the people who were trying to do their jobs. And he has mixed politics with a public health emergency. We cannot do this without strong presidential leadership, particularly when there's billions of dollars that need to get out the door through executive action and better coordination of the agencies.
Congressman, what is how would you characterize your access to the country's top scientists? Is it unfettered to people like Dr. Tony Fauci, or are you experiencing any bottlenecks in your ability to get questions answered from doctors in your district or constituents?
Well, I just got off the phone with one of the leading medical experts in my district. We have great medical professionals in the state of New York, obviously, and elsewhere around the country. I would trust Dr. Anthony Fauci with my life. The problem, as you know, is whether he's being hamstrung, whether the effort itself is being undermined by the message everyone's getting from the top. And we have seen this before. Comparisons are dangerous, but this is the president who used a Sharpie to make a hurricane go where he wanted it to go. This is the president who has denied Russian interference in our elections, despite all the evidence we know about. And so now we come to a public health emergency. He doesn't want it here. He doesn't want to acknowledge it. And that hamstrings the people who are trying to fight it. And in this time, it's going to affect all of us, and it's unacceptable.
You mentioned some of his political motivations and those other flashpoints of his 3-year presidency. I wonder what impact you think just the widespread concerns, and members of Congress are usually more in touch with this than people running for president because you see your constituents, you run into them at Costco, you see them at the baseball field. Do you think that is shaping the presidential contest, both the primary and the general election to come, in ways that are sort of underreported at this point?
Well, when I watched Joe Biden go out and speak last night, that looked like a president to me. And so I think that there is a flight to quality. I think there is a flight to normalcy. I think people want to understand that their president understands how serious this is, that they're going to bring the best people to the table. And so I think part of what you're seeing with the consolidation in the Democratic Party around Vice President Biden is the reassurance he will provide in this scary time that if he was in charge right now, we would be a lot better off, that he would be fighting this epidemic with all of the tools in our kit, just the way the Obama-Biden administration did during the Ebola crisis. We have a good model for this. Mm-hmm. We've got people like Ron Klain who did this already, who know how to marshal the resources at FEMA, at the Department of Homeland Security, at the other agencies that are on the front lines, CDC, FDA. And there are talented people who are waiting to be rallied and deployed with the resources that have been passed from the Congress. What's missing is leadership.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.